How to use Mifepristone and Misoprostol for an abortion with pills in the first 13 weeks of pregnancy. Every day, people around the world have safe medical abortions using Mifepristone and Misoprostol. When the instructions are followed properly, 95% will have a successful abortion. But remember, this information is useful for an abortion with pills in pregnancies that are below 13 weeks, counted from the first day of your last menstrual period. Before starting, follow these guidelines. Verify the number of weeks of pregnancy to be sure you are below 13 weeks. Try to schedule your abortion when you do not have any other activities and you can rest. Although complications are rare, it is important to have somebody with you and a plan of action in case of emergency. Think about self-care. Stay hydrated, eat a meal, drink some tea, use a hot compress or have a hot shower to soothe any cramping, and have pain medication ready, such as ibuprofen. Do everything that makes you comfortable, as if you were in your menstrual period. Medical conditions that are contraindications. Medical abortions below 13 weeks of pregnancy are very safe for the majority of people. But if you have certain medical conditions, it is not recommended to use abortion pills. Mifepristone is not recommended if you have been using long-term steroids such as prednisone or dexamethasone. You have a bleeding disorder such as porphyria. You have chronic adrenal failure. However, in these cases, having an abortion with just misoprostol is possible. Both Mifepristone and Misoprostol are not recommended if you are using anticoagulants such as heparin or warfarin. You are allergic to Mifepristone, Misoprostol, or prostaglandins. You have been diagnosed with an ectopic pregnancy. This requires specific treatment, and you should seek medical care. If you have an IUD, you can still use the abortion pills, but it does require some precautions because cramping is likely to be more intense and an IUD increases the risk of having an ectopic pregnancy. So whenever possible, it is safer to have the IUD removed prior to using the abortion pills. Abortion pills and dosage. You will need one pill of 200 milligrams of Mifepristone and at least 4 Misoprostol pills of 200 micrograms each, 800 micrograms in total. It's better to have an extra dose of 4 Misoprostol pills, 8 pills in total, 1,600 micrograms of Misoprostol, in case you need an extra dose to make sure the abortion is complete, especially if you are 9 to 13 weeks pregnant. If you only have 4 Misoprostol pills, you can still use them. 200 milligrams of Mifepristone and 200 micrograms of Misoprostol are the most common dosages, but if the pills you are getting have different dosages of milligrams and/or micrograms, you will need to recalculate the total number of pills so you can use the correct amount of medicine. The procedure. Step 1. Mifepristone. Swallow one 200 milligram pill of Mifepristone with a glass of water. The majority of people will not experience any symptoms after taking Mifepristone. Therefore, you can continue with your everyday activities. Some may see light bleeding. Even if you bleed, it's very important to take the Misoprostol pills to complete the abortion. If you throw up in the first 30 minutes after swallowing Mifepristone, it is likely that the pill will not work. In this case, if you have extra Mifepristone, you'll need to repeat Step 1. Wait 24 to 48 hours. Wait at least 24 hours, but no more than 48 hours. Any time between 24 and 48 hours will work. Pick a time within that range to start the next step when you'll have easy access to a bathroom and you can stay in a safe and comfy place for at least 12 hours, or even better, 24 hours. Step 2. Painkiller. Take 800 milligrams of ibuprofen or an alternative pain medicine about 30 minutes before using Misoprostol. This step is not required, but it is highly recommended because ibuprofen will reduce the intensity of the cramps and help you manage the possible side effects of Misoprostol. If you are allergic to ibuprofen, you can take other medicines like acetaminophen or paracetamol, 1,000 milligrams. If you have anti-nausea medicine, you can use it at this time too. Wait 30 minutes. Step 3. Misoprostol. Misoprostol is used differently from other medicines. This video will show you how to use it by placing it under your tongue, sublingual. If you want to learn about other ways to use misoprostol, please contact our counseling team for instructions. Place 4 misoprostol pills of 200 micrograms each underneath your tongue. The pills must remain there for 30 minutes in order to be absorbed into your system. You can swallow your saliva, but don't eat or drink during these 30 minutes. After 30 minutes, you can drink some water and swallow what's left of the pills. If you experience vomiting during the 30 minutes that you have the 4 misoprostol pills under your tongue, it is likely that the pills will not work. This means that you will need to repeat step 3 with a new dose of 4 misoprostol pills. Bleeding and cramping typically begin within 4 to 6 hours, but they may start as soon as 30 minutes after taking misoprostol, or could take up to 24 hours to begin. Step 4. If needed, take a second dose of misoprostol. For pregnancies under 9 weeks, usually a second dose of misoprostol is not needed. But if you don't bleed as much as a menstrual period within 24 hours, or if you think you're bleeding too little, you can repeat step 3 and take 4 additional misoprostol pills the same way as before. For pregnancies between 9 and 13 weeks, it's highly recommended using a second dose of misoprostol pills, as this makes the pills work better and is more likely to result in a successful abortion. Wait 4 hours after taking your first dose of misoprostol in step 3 and place 4 additional pills of misoprostol 200 micrograms each under your tongue. Follow the instructions as in step 3. Expected symptoms. You will know that the abortion has started when you experience cramping and abundant bleeding that is similar or heavier than your regular period, accompanied by the expulsion of blood clots and tissue, which can be different sizes depending on how far along the pregnancy was, and similar odor and color as your regular period. The duration of heavy bleeding and the intensity of cramps varies from person to person. You can continue to take pain medicine throughout the abortion process. Do not exceed the recommended dosage per day, and do not use regular aspirin, as it may increase the risk of hemorrhage. You can also use a hot compress on your stomach or warm drinks to alleviate the cramping. Side effects of the abortion pills. Most people don't experience side effects after taking mifepristone, but some might feel nauseous or have light bleeding. Misoprostol can cause diarrhea, nausea, vomiting, dizziness, stomachache, headache, fever, and chills. These side effects are normal and temporary and should disappear in the next 24 hours or less. Warning signs. When to seek help. It is important to pay attention to your body and how you feel throughout the entire process. Although not common, there are some warning signs that require immediate medical attention. If you fill 2 or more pads in 1 hour or less, and this lasts for 2 consecutive hours or more. If you have a fever of 38 degrees Celsius or 100.4 degrees Fahrenheit that starts in the next 24 hours after using the last dose of misoprostol and does not go down after taking ibuprofen. Always confirm with a thermometer. If you experience severe pain that does not get better after taking pain medication like ibuprofen. If you feel very sick or the color and/or smell of your blood is very different from your regular period. Blood can smell unpleasant and it can be brown, dark, or bright red. But if you have discharge of another color that smells rotten, it may be an infection. If you have redness or itchiness, or your hands, neck, and face are swollen, it is likely that you are having an allergic reaction to the medication. In this case, you can use an antihistamine, but if you find it difficult to breathe, then the allergic reaction is very serious and you need medical care immediately. Remember, if you need to seek medical attention, you do not have to say that you used abortion pills to induce an abortion, as the pills are not detectable if you have used them under your tongue. Post-abortion care. Having an abortion with pills takes around 15 days to complete. It is normal to experience bleeding for several days after taking the pills, but symptoms should continue to decrease. It's okay if the bleeding stops and starts, and it can continue until your next period, which often happens within 4 to 6 weeks. It is not mandatory to get an ultrasound after an abortion. If you want to confirm that the abortion was successful, you will need to wait 2 weeks to do an ultrasound and 4 to 5 weeks to do a blood or urine test to make sure the results are accurate. Taking a test sooner may give a false positive result. In the weeks following the abortion, take these precautions. Using pads is recommended to monitor your bleeding during the first few days of the abortion, but then you can switch to tampons or a cup as soon as you are comfortable. You can return to your normal activities, such as exercise, work, etc., as soon as you feel ready. It's completely normal to experience a range of emotions after an abortion. You might feel relieved, calm, and happy, or you might feel sadness, grief, or a mix of different feelings. Some people start to feel better right away, while others might need more time. If you're struggling, talking with someone you trust can offer support and comfort. There is no evidence for a recommended amount of time you must wait to have sex after using the abortion pills. You can have sex whenever you are ready. The most important thing is to listen to your body and desire. Your menstrual cycle may return in approximately 4 to 6 weeks. Your fertility can return very quickly, which means you can get pregnant if you have unprotected sex very shortly after your abortion, within as little as 2 weeks. If you wish to prevent an unwanted pregnancy, it is recommended that you start a contraceptive method right away. If you have any questions at all, please get in touch with our counselors by email at info@safetochoose.org or by live chat on safetochoose.org. You can also find us on social media at Safe to Choose. We are here to support you.